Hello, friends. So, just a brief snippet on patient consent. So, this I gather has been asked as a question in DRNB. So, these sort of elements can be asked as a question because these are some things which are important in day-to-day clinical care that we provide. So, informed consent is where we explain to the patient on the medical care plan and we explain to the patients on the risk and benefits. And it is also expected that we explain to the patients on the alternate plan to a patient who is competent enough to understand, and there is a voluntary acceptance given to what has been explained. So this whole process is called informed consent, where medical care plan has been explained, risks has been explained, benefits has been explained, and even whether there are any alternative ways for either doing the intervention or not doing, and acceptance of all these by a patient is what constitutes the whole science of consent. And there are two principles in consent. So the key aspect is the patient has an absolute right to exercise his or her control over what happens to his body. That remains at the forefront or the fulcrum of the consent, where one has to appreciate the rights of the patient who has an absolute control to determine what needs to happen to his or her body. So that is the quintessence of ethos that constitute consent, and that understanding the risk, acceptance of a procedure or a intervention has been given. So these constitutes, and this process is a legally enshrined. So it becomes a legal doctrine. So these are the three pillars of consent, where patient has an absolute right to determine what happens to the body, clearly understanding the risk component, and that process which gets signed becomes a legal doctrine. So these are the components. And one needs to clearly have an understanding what are the contents of the consent, because consent is a major issue in the court of law, and many a times the cases are argued based on the deficiency in the content that has been signed. So the condition of the patient has to be clearly elucidated in the consent, and the purpose of the intervention that is being done has to be clearly elucidated, and the consequences after doing a procedure or intervention, what are the possible consequences has to be elucidated, and the risks of the procedure, of the said procedure that is being done, has to be clearly elucidated. And it is also important to mention or describe what are the consequences if that particular intervention is not done. So, what is the prognosis if that particular intervention has not been done? Also constitute an important aspect of the consent, and consent also should include the cost. So, these are defined as the contents or components of a consent. So, condition of the patient should be clearly elucidated, the type of interventions, what is the consequence of the interventions, what are the risks associated. If that intervention is not done, what are the consequences or prognosis costs. So these are the salient aspects of the consent. And also it should consider, is there any other alternative ways if that intervention is, the intervention that is suggested is not done, are there any other alternatives also has to be mentioned. Then one has to describe on the eligibility for consent. So age becomes a eligible criteria for consent, and patient has to be in sound mind to, because he cannot be confused, or he cannot have a psychosis, or he cannot have a mental disorder, so on and so forth. He should not be under the influence of sedation, narcotics, and patient should have ability to understand and should have ability to deliberate on the treatment choices, and patient should be provided with adequate info that helps him or her to exercise the consent. So adequate information has to be provided. Then the question is, who can give consent? So age above 12, they can give consent for clinical examinations. So they can consent saying that they could be clinically examined. But for diagnostic workup and any interventions that one is doing, age has to be more than 18 years. And again, the eligibility criteria is patient should be of sound mind, and he or she should be able to give the consent not under threat or not under fear, and there should not be any sedation on board, or there should not be any psychiatric disability when consent is being given. And another important thing is, if someone is criminal if someone is being produced to for a medical examination under the criminal law by the police, so consent is not necessarily needed. So if you are meant to do an intervention on a criminal who is subjected or who is admitted to the hospital under the jurisdiction of the police, the consent is said that it's not needed for these where certain procedures has to be done. So consent, if you can't get it, it is good, but as a life-saving measure, consent may not be needed in a criminal sort of a case, is what has been done. So that's about it, folks. A simple, just a snippet as to the key components of the consent, eligibility criteria, and the salient features. So I request you all to submit your valuable work to Journal of Acute Care. Visit my website to rehear to this. Thank you. Thank you.